school season is in full swing, and for too many kids, that can mean a return to some pretty tough social situations. The Centers for Disease Control reports almost 1 in 3 kids between 6th and 12th grade has been a victim of bullying. Lots of kids never tell their parents they are in distress. But recently, the journal Pediatrics reported there can be clues. Researchers found an increase in headaches, sleep disturbances, and bedwetting. They can all be indicators that a child is being bullied. Joining me right now is Dr. Lauren Crosby from Lapeer Pediatrics. We thank you so much for being here today. The study, surprised at all by it?
Not at all. It's really confirming what we've really already known. There was a study in '09 that was one of the big studies, and since then, this study pulled all of them together and kind of looked at everything. They all came to the same conclusion. It confirmed that kids can have physical symptoms from the stress of bullying, what it does to them.
Now, doctor, how can you tell whether your child is truly sick, or perhaps this is an indicator of something of another issue?
It can be really difficult at first. So you want to watch for how often they have a complaint. If they have, if a kid has a headache one day or the stomach hurts one day, but then they're overall fine, you're probably not going to worry about it. But if it's something chronic where every day they're complaining of something, you're going to want to take them in to the doctor, get them checked out. If nothing is found, I find I'll talk to the kids and I'll say, you know what, I did some tests, I'm not finding anything. Let's talk. Is there something bothering you? Is there stress? Is someone, and we go through lists of things that could be triggering this.
It's really a form of nonverbal communication, isn't it?
It is. And they can have real symptoms, and that's the thing I think that a lot of people think maybe they're faking, but sometimes they actually lose weight and they really are sick from it. They actually can have abdominal pain. So when they use the word psychosomatic symptoms, it doesn't mean they're faking. They can have real severe headaches, not want to eat, feel like they can't breathe,
Right.
like an anxiety. So they need to come in. Also, sometimes they get reassurance, because we'll say, you know what, we checked everything out, you're okay, and that can also help, but then we still want to get to the bottom of it and what's causing it.
Let's talk about the various types of bullying, because I think most people think that it would take a very extroverted kind of effort of somebody being bullied, where you're pushed at school or someone screams at you in the hallway.
Right.
But there are subtler forms.
A lot of subtle forms of bullying. You can see that someone is just whispering even at you behind your back, or teasing you, or texting. So there's emotional, there's physical, there's verbal, and then there's cyberbullying too. So it can be through the internet, things on Facebook, emails, or text messages. And so you have to watch for all forms of bullying, and you can't ignore it. And I think that that's the thing too. If your child is even hinting that maybe someone is making their day uncomfortable, you want to probe and don't ignore it, and ask for help, and bring in the school counselor and the principal, have meetings, get the other kid and their family in there, sit down, work it out. These kids, they should not feel like they're a snitch. They need to know people have their back,
Right.
and that other kids, they'll help other kids too.
Now, we listed a few of the physical ailments that your child could suffer. Can you tell us some of the others?
Yeah, so dizziness is one, but the ones I do see the most are the headache, the stomach ache, unable to sleep. Sometimes they become forgetful. Sometimes you'll see they're losing things. Grades can go down. So a lot of signs that you might even see with depression too. Same kind of things. Can't sleep, don't want to eat, don't want to go to school. So school avoidance, so avoiding social situations.
It's really kind of a teaching moment, if you use it that way, to really open the channels of communication.
Yes.
How do you get into it, though, in a way where you don't embarrass your child?
Well, yeah, I think it's good for parents before school even starts, before the school year starts, to actually talk and bring it up first and go, look, you're going back to school, there's great kids and there's kids that may not be as nice, and I want you to know that if something's bothering you, if someone is saying things not nice or physically hurting you or anything, let us know, because we want to help you. And there's the issue with the cyberbullying, where texting or on the computer, parents' initial instinct is, I'm going to take your phone then. You can't have it because it's harming you, or you can't have your computer. And so what that does is the kids then are not going to tell their parents that someone is harming them in that way, because there's nothing. If you take their phone, you take their social connections, they're going to be more unhappy. So it's not going to work. You want to be able to either block numbers, block emails, block texts, or talk with other people to get that resolved.
All right. Dr. Crosby, thank you so much, of course, as all these students are going back to school.
Yes.
Very important information to have. And if you would like to discuss this further with Dr. Lauren Crosby, you can. You can follow her on Twitter. Her handle is Dr. Lauren Crosby, @Dr. Lauren Crosby. And now, Jeff, we're going to send it back to you.